hMPV outbreak in China. India on high alert. Three cases in Karnataka and Gujarat. States ramp up surveillance. Centre says India is ready. Government assures no cause for alarm. hMPV in India.
hMPV is the very latest acronym that you and I need to know about, especially since it's a virus that has emanated from China. It's been only 4 years since the COVID pandemic. Now, we don't intend to spread any panic or fear here, only to give you the facts and answer some of your questions regarding hMPV and what it really means. We will also compare it with the COVID pandemic, the virus that we know so much about, that has taken so much life. Is this something to be worried about, the hMPV? Most people don't even know what it stands for. It's human metapneumovirus, hMPV, that is now spreading in different parts of the world. Some initial cases have represented here in India as well, but I'm going to give you a factual, sober update on what you need to know to understand this virus. The human metapneumovirus, hMPV, is raising alarm in India. It's been only 4 years since the COVID pandemic began in early 2020, and I don't need to remind anyone about what it was like at this time in 2020. People were sort of aware of what was going on. There was a coronavirus outbreak that had taken place in China, but the problem had not reached the kind of gargantuan, deadly, global proportions that we got to know it would barely a few months later, including with global lockdowns and a completely new normal for humanity, not to mention thousands upon thousands upon thousands of deaths. The coronavirus pandemic, even though we don't feel it now, is still out there. We've only learned to just manage it. And right in the middle of that comes hMPV. It's raising its alarm, rightly so, in different parts of the world. 2 cases have been detected in Bengaluru, and 1 in Gujarat's Ahmedabad, and 1 in Bengal. hMPV causes symptoms very similar to the common cold in humans. The central government in India says that it is fully prepared and that there is no reason to worry. Here's a report on everything we know so far about the human metapneumovirus arising from China.
The hMPV virus has now been reported in India. The virus that makes infants ill and can cause a serious outcome in immunocompromised individuals is causing alarm in the country. 2 cases, one in Bengaluru in a 3-month-old infant who has recovered, and an 8-month-old baby has been seen already. Another case has been seen in a 2-month-old baby in Gujarat. The government of India says that the virus is in circulation in India for years now, like in many parts of the world, and that there is no reason to worry.
Metapneumovirus is like any other respiratory virus which causes a common cold. And in the very old and the very young, it could cause flu-like symptoms. The general precautions that we use against all respiratory infections, which means in case somebody has cough and cold, you should avoid coming in contact with a lot number of people so that the infection does not spread.
Last week, social media was flooded with pictures from China that showed overwhelmed hospitals and crematoriums. The World Health Organization has not said anything just yet on the extent of the crisis in China. India says they have sought more information. The government of India says that in the infections of hMPV seen in India right now, the patients had no travel history, no international travel history, indicating that the increase in cases seen in India right now has got no link to the outbreak in China. But we do not know just yet. The government says we are monitoring the situation very closely. Clearly, vigilance is at its peak given our experience 5 years ago. ILI, which is influenza-like illness, and SARI, which is severe acute respiratory infections, are being very closely monitored, says the Union Health Ministry. Perhaps patterns of an increase in influenza-like illnesses will give better indications about where we stand today. But right now, an increase in respiratory infections has not been seen, says the Government of India. The virus leads to symptoms similar to the flu, such as cough, fever, runny nose and sore throat. It may sometimes lead to more severe symptoms like pneumonia, a lung infection that causes air sacs to be filled with fluids. A severe infection is more likely in children under the age of 5 when they get the infection for the first time. It may also cause severe symptoms in the elderly and those who have a weakened immune system.
In the infants, they have not been exposed to the viruses, so they do not have the antibodies and enough, and apart from that, their immune system is also not fully developed. As a result, they are not able to fight out this virus.
What then are the precautions to be taken?
There could be some strain variation which could be there in the new strain, which is causing the outbreak in the area which is affected by currently circulating hMPV virus. But if I see of that of condition in India, I can say right now we are not suffering any panic situation related to hMPV virus, but yes, preparedness is always required.
China says this is a winter occurrence. Hong Kong and Malaysia too have now reported cases of the human Metapneumovirus. In New Delhi, Sneha Mordani for India Today TV.
And the cases are coming in. We've got news just in that one more case of the hMPV has been detected now in Kolkata. The case was detected not now, actually in November last year. A six-month-old infant was infected, later was released. 4 cases detected in India so far, like we said. 1 in Bengal, 1 in Gujarat and 2 in Bengaluru. All of the patients are small infants, small children. Sneha Mordani, who tracks health for us here on India Today, is with me live. Sneha, we just saw your comprehensive report. The government at this point of time is saying there's no need to worry. But, you know, those words are cold comfort, given most of us were told not to worry before the COVID pandemic as well. And look how it turned out. And without wanting to scare anyone or set off any panic bells, without due diligence, give it to us straight. Where are things right now? What's the government doing to prepare?
You know, Shiv, I'd like to just start by saying that our consolation is that this is not an unknown enemy. Unlike COVID-19, where there was a novel coronavirus that nobody knew about. It was novel, the name suggested. This has been in circulation for over 25 years, not just in China and India and many other countries. And that's the reason why no surprises, no root shocks here. We know about this infection, and India, unlike many other countries, I have to say this, the Indian Council of Medical Research has got a very, very robust surveillance network. And this network was in place even before COVID-19, given how we track ILI, which is influenza-like illnesses, and many other respiratory infections. ICMR has been doing this work for many, many years now. And it continues to do this work. And hence, 1 month we will see a set of viruses in circulation causing some infections. So, you'll have like just so many people down with a similar symptom and will be unwell. So that will be one virus. The next month there will be another virus. ICMR keeps track, and that's one consolation. The bad news, I would say in a way, is that there is no vaccination, just like influenza has got vaccination. Flu has got vaccination. hMPV does not have vaccination. And infants are vulnerable because their immune systems aren't developed. And so are immunocompromised individuals. So that is a bit of a concern there. The government says nothing to worry, because because the first alarm bell will be cluster increases that we will see in, in hospitals, upper respiratory tract infections. All of these children were in hospitals, and that's the reason why we know about them, because they were registered then. So hence, that kind of a rise in infection is not something that they are seeing, and that again is something to be relieved about. Of course, nobody is taking any chances. The government, I must say, has written to the World Health Organization already on Saturday, saying that we have to know more about the spread of the infection in China. But of course, the World Health Organization has said not a single word just yet on, the extent of this health crisis in China, given that the videos from China aren't very encouraging.
It's really incredible, and that's a whole separate story that Sneha is going to be detailing for us, how the WHO, that has been paid and funded by China for years together, has refused to do its duty and call out the threat of a multiplicity of health issues that emanate from that country. COVID-19 was a glaring example. Let's hope dereliction of duty by the WHO doesn't lead us down a disastrous path 4 years later. Sneha, thanks very much for that. Remember that Sneha and her team have put together a lot of pieces of information that you will see on our screen, especially in the bottom part of our screen. There are many FAQs that Sneha has put together, which will answer some of the common questions that you have, and we, of course, will continue to update them. Now let's bring in the experts, the people on the front line, healthcare specialists and doctors who will, if God forbid this becomes something bigger, will be out there treating patients and, looking at this with the background of what we learned during COVID. Welcoming Dr. Sanjeev Bagai, who's a well-known pediatrician, chairman and MD of Nephron Clinics, Dr. Rajesh Parikh, Director Medical Research and Neuropsychiatries at Jaslok Hospital and Research Center. To both the doctors, welcome and thank you for your time. It's tempting to look at hMPV, Dr. Bagai, I'll come to you first, through the prism of what happened just 4 years ago. There are some eerie similarities. Things started happening around the end of December. In January, the first few cases started appearing. And then things kind of blew up from there. Now, I'm pretty certain that's not going to be the way things go, but obviously nobody can take any chances, especially given the lessons, that we learned 4 years ago. Some of the similarities are those, worrying scenes that we're seeing in certain hospitals in China, the fact that this emanation has come directly from China. So, Dr. Bagai, your opening comments, how are you reading this? How worried should we be?
Good evening. I think China can't be trusted. That's been proven time and again, and more so during the COVID episode. They're a very opaque and a concealed society. There has been no information, again, with regards this virus, which has come out from China in the last few months. But having said that, this virus is almost 25 years old after it was discovered. It's been in India even before this outbreak in China. Yes. Through the data very carefully, there have been multiple outbreaks in Southeast Asia. There have been outbreaks in the Guan district in 2013 to 2017, which then spread mildly to Japan. Vietnam, there is a 10-year study from 2003 to 2013. The important point here to make is that this is not new. It's not novel. Yes. It is a mild disease. It is reaching its peak in children because the immune system is more immature. Between age group of 6 to 12 months, it is even milder than respiratory syncytial virus. It runs almost the same as influenza. The reason why these things are being highlighted now is because we are now more aware of it, and yes, our test is available. But routinely, we don't get these tests done for every child coming in with upper respiratory infections. The important point here to make is genetically, genomically, this particular virus, the pneumovirus, which is called hMPV, does not have the NSP proteins, which is the non-structural proteins. And it hasn't mutated in the last 24, 25 years the way COVID did over a period of short span of few months.
Important point.
Yeah, mutations haven't taken place. The genomic structure has not changed. It doesn't have the dreaded spike protein. It doesn't have the receptor binding protein. So genetically and genomically, it is much different. But having said, this is a wake-up call for us. Winter months, we see a surge, especially in children, of kinds of respiratory infections. But I must add, there has been no undue surge which we have seen because of this across OPDs and IPDs in children. There should be no to carry home messages. Avoid crowded places, poorly ventilated places, and wear a mask. If you have cold and cough, try to stay at home. Very important is don't self-medicate. Antibiotics are not required, and don't take painkillers which are NSAIDs, which can cause more harm than good. Inform your doctor, hydrate well. Personal hygiene is the key. No panic at all.
Absolutely. The new normal that the COVID pandemic brought us, I think some of those things may still actually apply. Washing your hands, personal hygiene, obviously staying in touch with your doctor and things like that. The things that were not so obvious pre-COVID and have become, second nature to most of us now, perhaps those things need to be re-emphasized. Dr. Parikh, how are you looking at it? Because the general public watching news reports, the instinct will be to panic. The instinct will be to say, oh my God, this is coming in from China. While it is very illuminating and sort of reassuring to hear that the hMPV is not a novel virus, it's been around for decades together, and we're only seeing an outbreak now. Most people don't know that. So when they're hearing about this thing coming from China, the understandable instinct will be panic. How are you reading this situation, sir?
Well, first of all, let me begin by complimenting you and Sneha in particular on the comprehensive and well-researched coverage that preceded our coming in over here.
Thank you.
Having said that, let me also say that not everything that comes from China is dangerous and lethal. Perhaps we have been sensitized by what happened and what went wrong during COVID-19, but there are several ameliorating factors which could reassure us somewhat at the stage at which we are. First of all, as has been pointed out, this is not a new virus. It was first officially detected in 2001. So as has been pointed out, so we're 25 years old. But there's something else that's interesting. When you look at serological evidence, when one looks at blood samples which were collected in the past, there seems to be fairly compelling evidence that it's been around since 1958. Which makes it, more than 60 years. The second, as has been pointed out, it is seasonal. It's a cold-sensitive, temperature-sensitive virus. So it doesn't do so well in heat, and it is seasonal, comes around in the winter, goes away in the summer, and it's done several rounds of this, which means to some degree there has already been herd immunity. The third, it is generally not lethal. There are certain vulnerable age groups, as has been pointed out, children. So it's nowhere near in terms of its lethality to COVID-19 and what it did. But the other thing that I think we should take some solace in is that we certainly have learned some lessons from COVID-19, what you call the new normal, but also in terms of responding to it, that we respond quickly, we recognize a threat, and we prepare for it. As Sneha pointed out, unfortunately, there is no vaccine, but there are other preventive measures which are not substantially different from what we did during COVID-19. And, we are reasonably prepared for it. And finally, I think it's important also for us to take some reassurance in the fact that currently it is an outbreak. It is not an epidemic and certainly nowhere close to a pandemic. True, we have a few cases in India, and in that, there is some parallel to what happened in COVID-19. But I think the differences between this virus and the coronavirus are far greater than the similarities.
Okay, I'm going to ask both of you doctors, to you, Dr. Bagai, first, because, we understand that the public watching is going to hang on to every word that doctors like yourselves are saying, because that's pretty much what everyone has to go on at this point. And unlike COVID, thankfully here there is a greater deal of clarity, I would say, in terms of what we are looking at and how to actually approach it and handle it. So, Dr. Bagai, I'm sure you've been getting calls from patients and patients' parents and things like that, asking them for your advice on what this thing really is and whether they can go about their lives and their work and their vacations and holidays and school and things like that. What are you telling people? What are you telling your patients, Dr. Bagai? To you first.
Yeah, so the messages really are that if there is a cold and cough, the carry-home message is observe. I've said this on every platform that the best doctor for a child is a mother. The mother knows the pattern of the child, the breathing pattern, the feeding pattern. If anything is unusual, bring it to the attention of the doctor. Do not medicate. Do not start on your own unnecessary rapid antibiotics. Do not use medicines apart from paracetamol. Any cold and cough persisting more than 36 to 48 hours, let the chest at least clinically be examined. Let the child be examined by the doctor. The other important thing is continue your normal feeding. Don't expose the child, especially in winter months, in pollution outside, it can exaggerate. Look out for early signs like breathlessness, panting, breathing. The full clinical examination of a child is very important to look out for respiratory issues. And otherwise, there is no need to panic whatsoever. The important point over here is this is even milder in a way than influenza or respiratory syncytial virus. Even the statistics of admissions and requiring any critical care is much lower. But having said that, this is brought to the fore again. Winter months, temperature changes, relative humidity changes, pollution increases, wear a mask. This is an airborne infection again. It can travel more than 6 feet. It can remain suspended in the room for hours. Wear a mask.
Dr. Parikh, same question to you. When you're getting calls from anxious parents or patients, what are you telling them? What advice are you giving them, sir?
Well, first of all, I'm not getting those calls because I'm not a pediatrician. I'm more involved, as head of medical research and policy matters.
I get it.
In fact, our infection control committee, which is very active, has called a meeting tomorrow at 3 in the afternoon for us to work out a general policy. But, Dr. Bagai has given us a very comprehensive coverage of, what we need to know. To that, I would like to add that at a certain level, while COVID-19 has sensitized us to what we need to do, but in some ways, it can also trigger the kind of alarms that the disease did when it went to its second and third wave. Quite simply, it's like an accident. Somebody gets into an accident, he becomes extra vigilant. There are a lot of good lessons to be learned from what goes wrong. But at the same time, I think it's equally important for us not to panic, not to be intimidated, to know that as far as this virus is concerned, our knowledge is considerable, unlike COVID-19, where we were dealing with a new virus. And fortunately for us, the preventive measures are very similar to what we practiced over 3 or 4 years. And I think the drill has been done. If you want to call it a dry run, it's been done at the individual level, at the family level, and at the community level in terms of policy. So I think we're reasonably well prepared. And we should just reassure people that do these basic preparations. A lot of things went wrong during COVID-19 in terms of people taking medications, left, right, and center, antibiotics, HCQ. And I think as Dr. Bagai has pointed out, we have to be careful of that. We should acknowledge there are no vaccines, but always remind ourselves this virus has done the rounds, humanity has withstood it, and undoubtedly we shall prevail again.
As I always say, there is no reassurance like the reassurance from a doctor directly. And that's the reason why we brought both Dr. Parikh and Dr. Bagai onto this show. Better to hear it from them straight, than from us who are only covering it and depending on the wisdom of experts like them. So I thank the both of you very much. To very quickly summarize what they said. They said this, unlike COVID-19, is a virus that we have a lot of knowledge about. The structures are in place. There is no need to panic. There are protocols on how to respond. And for the moment, just do the obvious things to stay safe and obviously stay in touch with your doctor. It is not an epidemic. It is nowhere close to being a pandemic and probably will never reach any of those proportions. But we need to be vigilant, and therefore the government and systems and states are already well prepared and exercise. Thank you to both our doctors for joining us. And now I'll tell you a tale of two timelines. This is in no way to trigger any kind of speculation or alarm. But remember, we're sitting here in January hearing about the hMPV. And January, just after December, is very similar to the time when the coronavirus 4 years ago also became a household word. COVID, 31st December 2019, China reported the outbreak to WHO, described it as a cluster of pneumonia cases. In the case of hMPV, late December 2024, very similar reports emerged of respiratory infections surging in China. The infections coincided with winter, when respiratory infections always peak. In the case of COVID, on the 7th of January 2020, Chinese scientists identified the novel coronavirus as the specific cause of the outbreak in Wuhan. In the case of hMPV, 1st Jan 2025, New Year's Day, social media posts highlighted overcrowded hospitals in China. In the case of COVID, 20th Jan 2020, the first confirmed case outside China was reported in the United States. In hMPV, 3rd January 2025 is when health officials confirmed hMPV spreading rapidly, symptoms similar to influenza and in some ways to COVID-19 as well. In the case of COVID, 30th January 2020, the World Health Organization declared it a public health emergency. In the case of hMPV, on the 3rd of January, Chinese authorities downplayed the situation, describing it as an annual winter occurrence. COVID case, 11th March 2020, WHO declared COVID-19 a global pandemic. That hasn't and is very unlikely to happen in the case of hMPV, because it bears repeating that hMPV has been around for a quarter century. We understand it well and know how to deal with it, so there is absolutely no cause for panic. And remember, if there is a graded response in terms of how we need to look at it, you will find those updates first here on India Today. Let's tell you a little bit about the hMPV global spread as well. Is it going to spread? Is it going to go beyond being just an outbreak in China? Well, there are causes for concern, because there are many things happening in the world right now which happened in 2020 that turned out to be super spreader events. There are trade fairs happening in China which could turn super spreader. Arab Blast in 2025 happens in Dubai between January 7th to 9th. That's going to happen sometime now. Could be a super spreader event, technically speaking. Pharma Pact Summit 2025 in Dallas in the United States. That's from January 24th to 25th. These are events to which thousands upon thousands of people attend. Petco Europe's annual conference 2025 is in Belgium between February 4th and 5th. America Pact Summit 2025, Dallas, February 24th to 25th. Budma 2025. It's a huge, one of the biggest construction fairs in Poland, February 12th to 15th. JEC World 2025, Paris, March 4th to 6th. Plastico, Brazil. It's a huge plastics and rubber fair in Sao Paulo, Brazil, March 24th to 28th. You've got the Davos World Economic Forum Summit that's happening there as well. So all of these are big events that turned out to be spreader cases during the COVID-19 pandemic. And I'm just saying that those are events that are happening now as well. I'm pretty certain that they will not have a bearing, but it's just good to know where the world is at this point of time. We've got some breaking news coming in. Okay, we've got news coming in that after the detection of hMPV cases in Bengaluru, the Karnataka Minister for Medical Education will be forming an advisory team on the hMPV virus, the human metapneumovirus. Karnataka's Health Ministry has issued an advisory, and I want to read that out verbatim. It says, wearing masks in crowded areas can reduce the risk of transmission. Just that one generic line saying, do continue to wear masks in public places. Remember, there are 2 cases, both infants, in Bengaluru. Here's what the Health Minister has just said.
This hMPV, which is there, it is a virus which has been existing in this country. Every year, as per the data that we have, Government of India, the data that they've given, and which we also have, is that out of the ILI cases, that is influenza-like illness, that is respiratory illnesses, in that 1% of the illnesses normally are due to this hMPV virus. Whatever in the future, what they're talking about in China and all those things are right now not connected to what is there over here.
India Today, Sagai Raj is live with me from Bengaluru. Sagai, advisory team has been constituted by the government in Karnataka. 2 cases in Bengaluru right now. The general sense is that there is nothing to panic. Everything is under control. What arrangements are being made? And the health ministry and the phone lines must be ringing with people wondering about whether the state is prepared.
Absolutely. In fact, Chief Minister Siddaramaiah has also spoken to media about this, where he has said that he has instructed Health Minister Dinesh Gundur to chair a meeting, and after chairing a meeting, Dinesh Gundur has categorically mentioned that they are waiting for the advisory from ICMR, because they have already sent a sample to Pune lab to test. The 2 children who have been tested positive for hMPV, those samples have been sent to Pune lab. So they are waiting for the directions from ICMR if there are strains are similar to the strains which has been identified in China, or it's a strain which is already exists in India from a long time. So there is a lot of confusion. But as of now, these children who were tested positive for hMPV have not travelled. Even their parents have not travelled anywhere across India or outside India. So there is no travel history of them for them to get infected of China virus. Probably this might be a local virus, but still they are not taking any kind of chance. They have sent the samples to the Pune lab. So we are waiting for the test reports on the same.
Sagai, thanks very much for that. We'll keep a very close track of that story. Our reporters and bureau chiefs in all of the states where cases have been detected, and there are only 4 cases, remember, so no cause for panic in India at this point of time. We will continue to bring you authentic, updated information that you can use right here on India Today, round the clock.